sooner you understand the causes of your hair fall, the future, and how you can preserve your hair and how you can take care of your transplanted hair, the better it is for you. Hair transplant in early 20s, hair transplant in 30s, or hair transplant in 50s. What and who is the best candidate and what is the best age to get this done? Let me for once and for all answer these questions and put this debate to rest. I am Dr. Viral Desai, a board certified cosmetic and plastic and hair transplant surgeon, doing hundreds and thousands of hair transplant over the last 25 years and having trained over 600 doctors nationally and globally. Every day, patients walk into my clinic along with their family members or friends and have so many questions. One of the commonest questions is, am I at the right age? Is this the right age for me to do my hair transplant? So let me give you an example. So Rahul walks into my clinic at the age of 25 and he has a receding hairline. He tells me, doctor, I am not happy with the way I look when I look into the mirror. What should I do? Should I do a hair transplant or I shouldn't do a hair transplant? Okay. His mother tells me that isn't he too young? Father is like, maybe not. Maybe he needs his hair to look good. His friends tell him that you're looking bald all the time and they're teasing him. So Rahul is confused what he should do. And Rahul is telling me that, doctor, I want to actually try for films. I want to try for TV. I'm in the media field. So with this hairline, I just cannot go. Nobody will accept me. I look much older than another 25-year-old looks. So here's the dilemma. Whom should I listen to? To his mother, to his friends, to Rahul? And whose demands should I cater to? Well, do understand that hair loss is progressive at that stage. But to label that you can't do it at 25 is also wrong. If it affects him emotionally, psychologically, socially, or it affects his job perspectives or the profession that he is in, you may consider doing a hairline correction or some other kind of correction even at early stages, but always keeping in mind that he will continue to take care of his remaining hair. So that is the catch here, that with a lot of care of his remaining hair, and constant monitoring and follow-ups, which he has to do for a number of years, and you may consider doing a hair transplant. And now imagine that Raj walks into my clinic at the age of 35. Raj is married, he has 2 children, young children, and he is saying that I am losing a lot of hair. I have become bald in the front and in the top. Do you think that I should do a hair transplant, or should I wait till I become balder, I lose more hair and then come back to your doctor? Now, at this situation, he knows that he stopped blaming the world, the environment, or shampoos or other stupid things that he was blaming earlier for his hair loss. He's realized that he has become more or less a little bit stable pattern hair loss. So then what would you do? Yes, if he has progressive hair loss or his other hair are weak, I would still treat them and then I would consider doing a hair transplant. Why would I wait till the age of 50 or 60 where he probably wouldn't even care about how he looks in most of the cases? But that's not true in everyone. But nowadays, generally after 45, 50 or especially after 60, people don't bother about the way they look. They want to enjoy the prime of their life, which is yes in 20s, but also in their 30s. And now it's even extending up to 40s. So why should he not enjoy a great hairline and good amount of hair on his head at the age of 35, 40? Why should he wait till 50? For what? And then walks into my clinic Ramesh. So Ramesh is now 52-year-old. He is thinking that he is bald definitely. He's losing hair also to some extent. But more or less he's lost most of his hair. And he's thinking that, doctor, I came here because my friends and my wife told me that I should come and consult you. But I think I should have done a hair transplant maybe 15, 20 years back or even 10 years back. So here's the question. Should he do a hair transplant at this age or should he just give up the idea? Well, again, if he's losing existing hair, take care of that first. But do you think he needs a hair transplant? Of course. If he is bothered by his looks, he's not happy with the way he looks, whether his hair feels, he definitely is a candidate. Age is no bar. In our clinic, we've done somebody who's 82-year-old. As long as the donor hair is healthy and the patient is fit to undergo this minor so-called minor surgery, there is absolutely no harm in doing a hair transplant, even at the age of 52. That is an age where probably he's turned mature, he's settled down in life, he's achieved what he had to achieve, and now he probably wants to enjoy his life further and his good looks. So, yes, at every age, even at the age of 50 or 60, it's always good to undergo a hair transplant. Age is not a bar. Whatever age you do, as long as you do it for the right reasons, as long as you do it with the right candidate, and as long as you know what the candidate is getting into and how he should take care of his transplanted and existing hair. If you still have any doubts, do call the numbers below and book a consultation with us. We will help you and guide you through this journey.